Hello, everyone. Thank you for joining us for another Ask Here live studio session. My name is Kieran McIsaac, and I'm an International Student Recruitment Officer here at Memorial University. With us today, we have Dr. Alice Gaudine, who is Dean of the Faculty of Nursing. Before we get started, I just have a couple of housekeeping items to mention. First of all, this session is being recorded, so if you are participating, you are consenting to that. Your mics are muted and the video is turned off, and this is just to help us facilitate the session. If you have a question, please do ask it in the chat box. That's the main reason we are here today, so we certainly want to be able to answer all of your questions. Today's focus is the Faculty of Nursing, so we want to keep our questions related to that faculty for this session. And if you have a question that we don't get to, don't worry, we will send you a direct message in the chat. So to get us started, Alice, would you mind giving us an overview of the Faculty of Nursing?
Thank you, Kier. I'm happy to be here today, and I look forward to hearing your questions. I'm Alice Gaudine, and I'm the Dean of the Faculty of Nursing. To our incoming students, congratulations on choosing such a rewarding profession, one that will provide you with many options, such as working in acute care, an emergency department, our intensive care unit, maternal child nursing, long-term care, palliative care, the community, or maybe even as a travel nurse when we're allowed to travel again. To tell you a little about the Faculty of Nursing, we offer a bachelor nursing program with a 4-year option and a 3-year accelerated option. This is the same bachelor nursing program that is offered at the Center for Nursing Studies and Western Regional School of Nursing. We also offer graduate programs. Our graduate programs include a Master's Science in Nursing program with practicum and nurse practitioner options and a PhD in nursing. I'd like to give a very special welcome to our new students who are joining us at such a unique time in our history. I think we can all agree that 2020 has created new challenges in how we live, work, and study. You are starting your nursing studies during a global pandemic. This will give you an opportunity to learn how very important nurses are in the healthcare system. And you will graduate with a strong knowledge base in infection control and prevention, probably a stronger knowledge base than any of the previous graduating classes will have graduated with. We're excited to have you with us and hope you are also feeling a little excited to be starting your program. Perhaps you are also feeling a little nervous about beginning your studies remotely. You are probably wondering what to expect as you start to learn remotely. But I can assure you that you have a fantastic group of professors and instructors who have been working really hard to prepare for this moment. We want you to get off to a great start. Earlier in the summer, we launched a Brightspace site for our new students called Welcome to Nursing 2020. Brightspace is Memorial's online learning system, so our site gives you the chance to use this technology. The site also has information to help you get ready for the year, including links to resources. It's also a great way to connect with your fellow students. If you have not yet done so, I encourage you to check out this site. We have also planned a virtual orientation in Brightspace for our new students on Tuesday, September the 8th. You will learn more about the Faculty of Nursing, get lots of useful information, and meet your faculty virtually. You will also have a chance to meet more senior students who are assisting with your orientation. They are members of our nursing society, and you will have a chance to get involved with this very active group. You will learn about the option of joining our peer mentorship program, where you can be linked with the more senior nursing students. Your professors and instructors are planning time for plenty of interaction, questions and answers, group discussions, and seminars within your remote courses. Remember that while you will be interacting with everyone remotely this fall, before long, you will meet us in person, and some of your classmates will become your long life friends. As you get ready for your orientation and for the start of your first year, I want to offer a suggestion because nursing is a challenging program and it's best to get off to a good start. I suggest that from the first day of classes, you structure your day, attend remote sessions, and participate to the full extent that you can. Make yourselves a schedule and make sure that schedule includes break times too. Try not to let things slide. If there is something you are having difficulty with, reach out for help. During the summer, students in the accelerated option took their nursing courses remotely. They were able to participate in classes that were also recorded in case they had an internet connectivity issue during class time. They participated in online discussion forums and watched demonstrations of nursing skills. While much of the nursing program can be offered remotely, students also need to learn skills in our Nursing Resource Center and to learn nursing practice in a clinical setting. Students in second, third, and fourth years of our Bachelor in Nursing program are coming to campus this fall for nursing skill labs and clinical placements. This is being done with strict guidelines for limiting the number of students and instructors in the lab at one time, wearing masks, carrying out proper hand hygiene, and frequent cleaning of rooms and equipment. First-year students will not have to come to campus this fall, as you know. We have moved your fall nursing skills lab to the winter semester. However, it is our hope that you will be able to do your on-site labs and your clinical placement on-site in January. We very much look forward to meeting you. So again, welcome to the Faculty of Nursing, and I wish you all the best as you set out on this new path.
Well, what a wonderful welcome. Thank you for that, Alice. And some excellent tips in there as well. I touched on some of the questions that I had to ask you also. But to get it started in terms of questions, again, I want to invite everyone that's here today to ask any questions you have in the chat box function of the WebEx platform, and the questions will come through to me as well. But just to get us started, if there was one thing that you would like all first-year students to know, what would that be?
I think if there was one thing, I would want them to know that they had really made a good decision by choosing nursing. It's a very interesting profession where you get to contribute much, where it's very rewarding to you. And I think I'd also want them to know that they made a good decision by choosing our Faculty in Nursing or the Center for Nursing Studies or Western. It's one of the strongest programs in Canada with the most clinical hours and the most learning lab hours, and our graduates are well recognized across Canada.
Excellent. Now, if a student is facing some difficulties with their academics in first year, how can they get support for their studies?
Okay. A key thing is make sure you reach out to your professor and let them know if you're not following something. The same way that during this conference you can write something in the chat box, you can ask a question there. There will be discussion forums where you can ask for questions and clarifications. In addition to that, I am actually going to be hiring a few undergraduate nursing students that are in third or fourth year to serve as peer tutors. And they will probably have some useful tips for you and be able to guide you into the in the program, as well as I mentioned before. Sign up for our peer mentoring program, and for that, a senior nursing student will agree to be your mentor, and will help you.
Excellent. Yeah, that's a great initiative. Tell us a little bit about what first year classes are going to look like this fall. What platform will they be on, for instance? What can a student expect from a first year nursing course this year?
Okay. I think all courses in first year, first semester will be remote. So you will access them all through Brightspace, the university's platform. You'll have a different course shell set up for all of your courses. In first year, you also take a non-nursing course and you take biochemistry from the science department, but they're all set up the same way on Brightspace. Within the Brightspace shell, you'll be able to see your course outline or syllabus, and that has all the information you need about what texts are going to be used, when. The most important part that most students look to first, I always did as a student, is the evaluation part. So you can sort of know, is there a midterm exam? Is there a final exam? Do I have to write a term paper? How much are they worth? That'll all be there. I encourage you, come to your first class if anything happens and the bandwidth in the region you're living doesn't work. It will be posted afterwards, so you'll be able to see it.
Great, excellent. Now, in terms of laboratory components, we've had a question about, if the university ends up going remote again this winter, would students be expected to be coming in for labs? And a related question, what do labs look like sort of in a remote environment?
Okay, interesting question. And for example, in the fall, you're taking, first year students will be taking anatomy and physiology. There is a lab for that course. Normally, you'd be going to a lab that we refer to as a wet lab, and you'd actually perhaps be looking at real specimens. Instead, you'll be looking at them remotely, and you'll be guided through, what would have been the lab. But the objectives of that lab will be met remotely, but they'll be met through different learning techniques. After Christmas, the first year students have 2 labs, health assessment and the foundation lab 1017. Our hope is that you're able to come to campus for them. If the province mandates a lockdown to the extent they did last March and nobody's allowed to come to campus, then we will do the labs to the extent we can remotely. And then when you are later able to come to campus, you would get some hands-on experience where you might practice. So we'll have to cross that bridge when we get there. But the province has been managing COVID-19 very well to date, and we're very hopeful that you're able to come to campus in the winter.
Absolutely. And I should clarify for those that are joining us that the university has not yet made a decision on the mode of delivery for the winter semester. So we expect a decision to be made in the coming weeks, and keep an eye out for that. And further details will be forthcoming. But in the meantime, thank you for that reassurance, Alice. Now, in terms of studying online, do you have any study tips for learning online?
I think, one of the things is to try and participate in everything that's going on. So, for example, within the Brightspace under conversation or communication, under communication, I attended an orientation for faculty today, and it's the first time I used that type of an interface. I've been using WebEx and Zoom and other things since March. So I had trouble getting in, but I couldn't help notice, well, there's a phone number. So I phoned and I listened to everything on the phone, which was, quite well. So there's another tip if you can't get in by the internet, but you have a phone plan that gives you free phone calls throughout Canada. That would have worked for me in that instance.
Yes, yeah. So it's getting to know that technology and getting to know that there are sometimes multiple channels to get the connection that you need. In a sense, that's a good point.
Yeah, and I think.
Sorry, go ahead.
There are other basics, and they're so basic I hesitate to say them, but at the same time, all of us, including myself, don't do them. One of them is you really can only stare at a screen for so long before your eyes get sort of fatigued. So the other thing is, you know, you can only really sit for so long. So I encourage everyone every hour to get up for at least 5, preferably 10 minutes and take a break. But also, if you were on campus, you would be taking, you know, coffee breaks, lunch breaks. Somehow when you get in front of a computer, it's easy to just let the time go by and not do some of those things. So it's important to get outside, go for a walk, get some fresh air, but schedule everything, schedule study time.
That's right. Yeah, and it's so important not only for studying, but even just to maintain our health, our good health. You know, to get up and stretch and take breaks and get outside and that sort of thing. That's really important. I just wanted to reiterate for some of the students that may have joined us late that if you do have questions for Dr. Alice Gaudine, that you can ask them in the chat box and we'll pass them along. So please continue to ask your questions there. Alice, what do you hope your students experience in their first year at Memorial?
I think in the first year, I hope they get to know each other and to get to know us. Um, I I hope that they will get the foundation courses uh, that are so essential before you go on to medical surgical units and actually practice things. And sometimes first year can be sort of challenging because it takes a while for everything to come together and to realize why some of the things you're learning in first year are really important. But you know, we have to start somewhere. And I think in particular, the therapeutic relationship course that you take this fall, you'll have a lot of opportunities to work in small groups and to practice interviewing each other. And I think it'll give you a really good opportunity to get to know each other. And it's the content of that course, communication and therapeutic relationships, is one that is really important throughout your entire career.
Excellent. We had a question about, I guess, equipment or supplies for first year courses. Is there any particular supplies or equipment that students are expected to purchase for their first year?
Mhm. Uh, the course outlines or course syllabus, they're sometimes referred to, for each course outlines under resources any textbooks or resources that you need. And definitely before you go into the first clinical course, 1520, you need to buy the school uniform. You know, there's things like a stethoscope that you would need to purchase, you know, and a few other items. There are also certain labs that you need certain, you know, materials for. And for any course, though, this is listed for it. And for labs that you need equipment, there's a way that you can order that, your lab kit for a particular course from our bookstore.
Excellent. So the bookstore website would have some more information about that then.
It's actually in the course syllabus so that when they contact the bookstore, you would know exactly what to ask for.
Perfect. Okay. Okay. Excellent. How can students get in touch with an academic advisor for the Faculty of Nursing?
Okay, well, course, uh, their faculty member is really their first person to go to. The person, Jennifer Bishop, is our academic program administrator for our undergraduate program. She would be the next person to go to if you have an issue to discuss. If you felt the issue needed to be brought to the attention of the associate dean for the undergraduate program, that's Dr. Sandra McDonald. Her secretary is Jennifer Bishop. So while we're remote, you would email Jennifer and ask if you could have a time to talk with the associate dean. But in the first instance, the academic program advisor is the person to go to.
Okay, yeah. So start there for sure.
Mhm.
Um, Following up on an earlier question, we've been asked, are there multiple online sources you'll be using for classes, such as, say, Zoom, WebEx, or will students be mostly using chat rooms in Brightspace, for instance? Can you speak to that?
Okay, we won't be using Zoom. Uh, the um, uh, the communication form in Brightspace is the primary form that we'll be using. Um, for today's meeting, I see we're using WebEx. WebEx has certain advantages over the online room, but it is free to you if your professor decides to use it. Um, and so I think you'll probably see a mixture of both. One of the advantages of WebEx is that if you chose to at the moment, you could all show your videos unless you're connecting by phone, right? Whereas with Brightspace, it's a little more challenging after a certain number of people get on. The other nice thing about WebEx is that I think we can all share our screen. You probably see at the bottom of the screen a little box, but the top of the box isn't completed and there's an arrow. If you click on that, you could show people anything that you had on your screen. Um, so I must say I'm a fan of WebEx, but that's because I've been using it since March, and other people have been using the Brightspace communication um, tool, and they like it. So I guess you'll probably get used to both of them. And from my general experience, I find that people that are younger than me have significantly less trouble in adapting to technology.
That's a key skill, I think, that adaptability coming
Mhm.
into online study for sure. Another question, sort of about the sort of practical side of how the courses are going to work. How are exams and tests going to be structured through remote and online learning?
Okay. Um, they will be done remotely when we're remote. And Brightspace has a site where you go to, and they can be timed, and I'll go in and write an exam and click on your answer. Some of our exams will use a different platform called ProctorU. We used this past summer for I think about 5 courses. Um, we have some experience now with remote teaching and learning in the Faculty of Nursing because we have students and courses offered in the spring semester because of our accelerated option. So we had a chance to test some things. With ProctorU, there is an invigilator who will be able to observe you as well as a few other students during the exam. So it is the same as an invigilated exam. But again, you would write it online from a screen, which is excellent preparation for when you finish our nursing program and you write your registration exam for licensure as a registered nurse. That's an exam that's done electronically. It's also an exam that when you answer one question, after you click on it, you can't go back and look at that exam question. So I don't want to start getting you feeling nervous and scary because the topic of exams is not really particular to context, because when you talk about an exam and you haven't even learned the material yet, it's easy to get more anxious than you need to be. But, again, I say that your professors are there and they've walked many students through some of these stressful processes, and we have I guess one thing I should say is that we have a high number of applications for our nursing program. And it's part of the reasons why I said congratulations for being admitted into the nursing program. You're coming in, you have done well in the past, and if you work, and it will be more work than probably what you've done before, even if you've been in other university programs here. There's no question it's a challenging program, but you do have the abilities to be successful and to pass all these exams. And so I don't want you to uh, stress yourself out too much by thinking about that at the present time.
That's a good perspective to take for sure. Yeah. We've had a question about a decrease in preceptorship hours. And so I'm not sure on the details on that myself, but the student is wondering whether that will affect a student's chances for employment when they graduate. So you know probably more about this than I do.
Yeah. I think there's several things to keep in mind. For people that are starting, and if I'm talking to first year students or students starting in September, um, unless we get locked out of clinical, your clinical hours will be consistent with what our program, has been, and is about the highest in the country. For people that are doing their preceptorship, I'm sure these are people that have just finished year 3 and are going into year 4. They should have done their preceptorship this summer, but were unable to. Instead, they did a community course. And so their preceptor course was changed from 8 weeks to 6 weeks. Now, we're doing that with the watchful eye because you still have to meet the competencies. And if you don't, there is room, I think, to have any student stay a little bit longer than 6 weeks. In terms of getting a job elsewhere, every school and faculty of nursing across the country has been doing similar things, has replaced, up to 25% in many cases of the clinical hours with online simulation. And I do not think it will affect employability for 2 reasons. One is there is a need for registered nurses all across the country. And 2 is if you have a couple of weeks fewer clinical, rest assured that people graduating from the other schools have 2 weeks or more, and that our school had more hours to begin with. I think the other thing is that when you start a new job, you should be honest with your employer and your nurse manager and your first job about the type of orientation you feel you need. And if you feel you need a bit more orientation, I think you should speak up.
Excellent. Yes. Yeah. Great advice there. We're just about to finish up. I wanted to ask one last question, and that's how can students get more involved with the Faculty of Nursing? Are there any student societies, research opportunities, extracurricular activities? Any advice there?
Absolutely. There's lots of ways to get involved in the Faculty of Nursing, and I really encourage you to do this. We have a very active nursing society. In fact, they're the ones that organize the mentorship program where 3rd and 4th year students serve as mentors to incoming students. I really recommend that you ask for a mentor and that later on you become a mentor. Our student society also organizes other activities. At the moment, I think there's a Shinorama raising money for cystic fibrosis. They often order a charity ball every spring. Now, this past spring, and with this Shinorama, these events have been done remote. So we've had remote biddings on Facebook as a fundraiser on bidding on instead of a live auction. You sort of bid on things. So there's lots of activities going on. Yeah.
That's great. So we're coming right up on our scheduled finish time, the half-hour mark. So I wanted to thank you so much for your time today, Alice, and also to thank everyone who's in the room for joining us today. If you have any other questions, I invite you to please feel free to email us at ask@mun.ca, and be sure to check out our next session, which will feature a senior student panel discussing first week preparation, and that's this Friday at 2 p.m. Newfoundland time. Thank you to everyone, and have a great rest of your day.
Thank you, everyone. Oh, you're... backwards, so you can drag it actually in the opposite direction, up over here. Let's see, it's over there. That's amazing.
Great. Well, thank you so much again, Alice, for your time
Thank
today.
you, Kira. It was great to see you, and let me know when we're going to the Philippines to look for students.
Absolutely.
I think it's post-pandemic.
Well, we're doing a lot of virtual fairs right now, actually. So we're still able to connect with students. Students are still very interested in coming, but it isn't quite the same experience, not being able to have that face-to-face conversation. So we hope for a return to normal recruitment activities in the near future, but in the meantime, we're doing the best we can. I heard that there are some, perhaps a couple of international students maybe starting this fall.
We have international students. I'm trying to think if they're starting this fall. I'd have to think about that.
Yeah.
Yeah.
No, we had a session a few weeks ago with representation from the 3 nursing sites, and we just a little bit about that. I was curious to see what kind of uptake we've had this year, but
yeah, I think it's pretty minimal.
Yeah.
And I don't. I think there's 1 or 2, but I think one's in the United States.
Yeah.
So,
yeah. Well, let's keep in touch anyway. Yeah.
Great.
Thanks again. A lot. Have a great day.
Bye-bye.
Bye now.
I was just trying to read.